When going through cancer treatment, your body needs more nutrition to help you feel better and heal faster. These extra nutrients can be hard to get on your own and could make mealtime stressful. That's why your dietitian may recommend a feeding tube. Feeding tubes are common with cancer patients, and no patient or parent should feel defeated if a feeding tube is suggested. All feeding tubes are a temporary solution and will be needed only until your dietary needs go back to normal. Your dietitian will talk to you throughout the process. There are 3 types of feeding tubes that may be an option for you. The most common is a nasogastric tube or NG tube. NG tubes get nutrition into your body by taking the nutrients directly into your stomach. The process starts by placing the tube in your nose. The tube runs through your nose, down your food pipe or esophagus, and into your stomach. Nasojejunal or NJ tubes are similar to NG tubes. NJ tubes continue through the stomach to the lower intestine, and though they are less common than NG tubes, they may be required if you can't tolerate an NG feed. Having the NG tube or NJ tube placed is not a painful experience, though you may have some discomfort as the tube moves down your throat. A nurse will come to your room to place the NG tube. We can tuck the extra length of the tube behind your ear so that it's out of the way when it's not being used to feed. Another type of feeding tube is a gastrostomy tube or G-tube, which also delivers nutrients directly to the stomach. G-tubes are placed through a surgical procedure directly into your stomach. Once placed, the tube is easily hidden under your shirt and should not interfere with your daily activities. You will be able to shower, bathe, and even swim with the G-tube. G-tubes may be required if you are going to need head, neck, or chest radiation, or if you have trouble using the NG tube. Don't let chemotherapy control your diet. Using a feeding tube is the most natural way to take back control of your nutrition. Using feeding tubes to get the nutrition you need helps lower the risk of infection, which means you spend less time in the hospital. Feeding tubes are also convenient for you and your parents, since they allow you to receive nutrition at night while you sleep, receive medications, and can help keep you hydrated. Your dietitian will work with you and your parents to come up with the best nutritional plan using your feeding tube. If you have any more questions or concerns regarding feeding tubes, don't be afraid to ask your dietitian.